The Malaysian government's commitment to improving mental health service by National Strategic Plan for Mental Health and SPMH 2020 till 2025 as a comprehensive policy document transition from hospital-based to community-based approach to enhance accessibility and integration of mental health care. This is to ensure support within the community and daily life, and SPMH 2020 till 2025 as a roadmap for achieving these goals. Evolutionary approach. The NSPMH has embraced an evolutionary approach to meet the changing landscape of mental health care. Established in 2001, it has undergone significant revision over the years. Each subsequent plan builds upon the success and lesson learned from the previous strategy, ensuring that it remains responsive to evolving needs and challenges in mental health care. Achievement and lesson learned. The NSPMH has yielded notable achievements in enhanced mental health care across Malaysia. The constellation of accomplishment from previous plans has led to significant improvement in the overall mental health landscape. The prevalence of stigma and discrimination towards individuals with mental illness in Malaysia is a significant barrier to seeking treatment. The study conducted by the Malaysian Mental Health Association reveals that 80% of Malaysians perceive mental illness patients as dangerous and unpredictable. The stigma prevents many individuals from seeking the necessary help, leading to worsening symptoms and untreated mental health issues. Malaysia faces a shortage of mental health expert facilities and funding, with only 0.1 psychiatrists and 0.5 psychologists per 100,000 people. Access to mental health care is limited, particularly in rural areas. The scarcity of mental health professionals and facilities result in inadequate therapy and long wait times for patients. The plan aims to make it easier for everyone, regardless of their financial status or geographic location, to access high-quality mental health service. This objective involves increasing the availability of mental health centers and facilities, hiring more mental health professionals, and utilizing technologies like Skype to reach underserved areas. Another important objective of the plan is to improve people's knowledge and understanding of mental health, reduce the associated stigma, and promote help-seeking behavior. This objective involves raising awareness about mental health conditions, fostering positive attitude towards mental health, and educating communities about the signs, symptoms, risk factors, and solutions related to mental health problems.
Thank you, AZNIEZA. Right now, I will present about the programs that have been implemented in this policy. The first program is Let's Talk Healthy Mind campaign. This program focuses teenagers and working adults due to the high percentage of depression and stress among them. This program comes with the word talks. It is not a word, but each of the alphabet have their own meaning. So, in these programs, there are 4 main points that have been highlighted. The first one, if you facing problem, don't just stay silent, but find someone who you can share their problems. Second, find people you can trust, like family or friends, to ask for help. Third, when someone share a problem, don't be quick to judge, but help them to find a solution. And lastly, see a counselor if you start to signs of depression or stress. In clearly, this program gives a positive effect that encourage people to reduce the percentage of depressions that happening in our community. The second one is psychosocial rehabilitations for mental patients. This initiative is come from Ministry of Health, which is to help individuals with disabilities due to mental illness. Among the activities under psychosocial rehabilitations are job search skills, financial management, leisure activity, and so on. For example, in terms of daily activities, there will be assistance and train on the use of public transport to make them easy to go to work. In clearly, this initiative gives them the opportunity to start a new life and indirectly allow them to lead normal life like other people. Lastly is Healthy Mind program to curb mental disorder. So this program focuses on teenagers, especially as students. Among activities in this program is promoting mental health through lecture, exhibition, quizzes, and so on. This can provide information and knowledge and indirectly can give awareness about the mental health. Not only that, the involvement of parents also make this program more effective because it will give parents yearly awareness to know the level of mental health of their children. That's all from me. Next, we move to the next presenter.
The first reform is psychosocial support helpline. Mental problems often occur in society, especially during the COVID-19 pandemic. This has disturbed the emotional and mental health of the community. To overcome this problem, the Ministry of Health has established a psychosocial support helpline. This line has received hundreds of thousands of callers who need help to get their mental and emotional support. Almost of the callers experience this problem due to some social problems, which are lost sources of income, experiencing and having problems in the family. This line is regulated by Ministry of Health Counseling Psychology Officer and also been assisted by the psychology officer from various agencies and NGO. This line has provided mental health screening. The officer on duty at that time will give a form online to the patient. This can determine the level of mental and emotional health of each patient. In addition, this line also provides a psychological session called PFA. This session is conducted individually and also in group. With this, it can reduce mental and emotional problems in the community. The second reform is the establishment of the National Mental Health Center of Excellence. The government is very serious about curbing mental and emotional health problems that occur in the community, and that's why the government established this reform. This reform has become an earlier preventive measure for patients to prevent their mental health from becoming more serious. Suicide cases has been increasing since 2021 due to the extreme stress, which has also been the reason for the establishment of this reform. This establishment can help patients where they can get help that treatment at this center. Example of treatment that can be obtained are counseling sessions with expert, mental tests, and can get support services. With that, it can be reduced stress that experienced by them. So that's why this reform is very important. The third reform is mental health services at 1,001 clinics throughout Malaysia. According to Datuk Dr. Zulkifli Ahmad, among services that provide is the initial verification of mental patient as well as the management of cases related to suicide attempts. Besides, psychiatric services in 4 mental institutions and 61 hospitals in Malaysia are also implemented by the ministry. A total of 148 psychological officers, which are trained counseling officers, have become part of the group that become a part of counseling and psychological services. This aims to empower mental health services. In addition to that, the Ministry of Health has collaborated with the Malaysian Ministry of Education to run Health Mind program for school students. This aims to give awareness to students not to be violent, such as bullying, which can put pressure on victims who experience it. To reduce this, the Ministry of Health has promoted the Best Frienders service to help students with mental and emotional problems.
Now, we're moving on to the challenges faced by the government in implementing this strategic plan. The first challenge is limited mental health resources that caused by economic restraint in the country. The resources here includes the services, infrastructures, and workforce in mental health industry such as therapists and psychologists. According to the Malaysian Medic International, Malaysia is supposed to have one psychologist for every 10,000 people, which is equal to approximately 3,000 mental health practitioners. However, there are just 479 registered psychiatrists as of February 2022. So here we can see that the available therapists are not able to handle a big amount of patients at one time. So this problem has caused the individuals of mental illness to be left untreated, and it is hard for the government to solve this problem in a short time. The second challenge is the increasing suicidal behavior. Suicidal behavior here includes any self-injurious acts, suicide attempts, or any thoughts that someone intentionally done to end their life. Most of this behavior are mostly related to mental health issues such as depression, anxiety, stress, and trauma, and these can be caused by various factors like family violence and peer bullying. According to National Health Morbidity Survey, they revealed in 2019, among 424,000 children that have mental problems did not seek for treatment. This situation has become a problem for the government to handle because when the suicidal behavior among citizens are increasing, but they did not seek for treatment even though it already has been provided. The third challenge is the stigma of society towards mental illness individuals. Stigma is a negative perception that creates prejudice and discrimination towards a group of people. Stigma towards people with mental health issues remains high in Malaysia, which becomes one of the challenges of the implementation for this National Strategic Plan for Mental Health. In this strategic plan, the Ministry of Health is creating initiatives to persuade individuals suffering with mental health problems to get treatment. However, this effort may be useless if society still has this mindset towards the patients. From the negative stigma, it will lead to discrimination where the public are treating someone with mental illness negatively. With this type of stigma and mindset, any initiative made by the government to cure this problem in the society may not be effective, as the sufferers' problems tend to be worse and also stop them from getting help when they need.
Hi, I'm MAZRIENA. So the first solution to mitigate policy implementation challenges is rational extensive mental health budgets, assessing resources and demand, estimating the need for mental health care, setting target based on priorities identified through a comparison of existing services and needs, and implementing them through ongoing service management. Budgeting and evaluation are all ways to accomplish this. For example, in New Zealand, the 2019 Wellbeing Budget prioritized 5 key areas: mental health, child well-being, promoting Mori and Pacifica community goals, developing a prosperous country, and turning the financial system. It announced billions of dollars in funding for mental health services and child poverty relief, as well as a record-breaking investment in domestic violence prevention strategies. It also emphasizes the roles of doctors in non-medical solutions.
Hello, I'm IRDINA. I will continue to explain the second resolution to mitigate the increasing suicidal behavior. Promote responsible media reporting on suicide can be the resolution to mitigate this challenge. This resolution is crucial to prevent the risk of copycat suicides and to ensure that those affected by suicide can receive the support they need. There are some ways to promote responsible media reporting on suicide. Firstly, the media outlets need to follow the guideline reporting suicides by the reputable organizations such as the World Health Organizations. Next, the media should avoid to giving the explicit details about the methods or locations of suicide. Additionally, media outlets need to provide support information about resources for people who are affected by the suicides, such as crisis hotlines and so on. To be an example for these resolutions, the Samaritans in the UK have created media guidelines for reporting on suicides. They offer advice on appropriate wording, imagery, and headlines. Hence, by promoting responsible media reporting on suicide, it can ensure that those affected by suicide can receive the support they need. In addition, the resolution to mitigate the challenge about the negative stigma of society towards mental illness is an anti-stigma program. It is a campaign or initiative that aims to reduce discriminations and negative attitudes towards people or groups who are stigmatized due to the certain characteristics or conditions. This program seeks to increase public awareness, knowledge, and understanding of the stigmatized conditions, and so on. According to the HUSNIMAN, to know whether an anti-stigma program is the best solution or not, at least 3 large national anti-stigma programs have built formal staff with the university resources to conduct evaluation of anti-stigma program. For example, in the United Kingdom, the Time to Change program is aimed to measure changes in public attitudes towards mental illness. The results show that there is no improvement in knowledge or behavior of public toward an anti-stigma program, but improved employer recognition of common mental health problems. In New Zealand, the Like Mind Anti-Stigma program is aimed to assess the personal experience of discrimination among mental health service users. Over half of the participants reported some improvement in stigma and discrimination. The next example in Canada, the anti-stigma program is known as Opening Minds. Results show that contact-based education has the potential to reduce the prejudicial attitudes and improve social acceptance of people's mental illness. Thus, based on the results of anti-stigma program by these 3 countries, there is an improvement of people perceptions against people with mental illness.
As conclusion, the National Mental Health Policy and National Strategic Plan for Mental Health in Malaysia are essential for people's well-being. It needs to change from viewing mental health as only a public health issue to one that acknowledges the manner in which opportunities for life, right from prejudice relating in an environment, and a variety of other aspects influence well-being. The implementation of the programs conducted under the National Strategic Plan for Mental Health are positive initiatives taken by the Ministry of Health Malaysia to address mental health issues in the country. The plan has also implemented several reforms to improve mental health services and address mental and emotional problems in the community. By recognizing and addressing these challenges, policymakers can develop effective strategies to ensure the successful implementation of the plan. That's all from us. Thank you.